Where did you go to school?
USC.
USC. And what was it like going there?
It was great, actually. I went the first 4 years undergraduate, and then I looked at the graduate schools and went around and decided dentistry looked good. So
I'm sure that's a well-known dentistry school.
Excellent, well-known dental school.
Yeah.
A lot of it's because of the alumni support at the private schools.
Right.
So the instructor level is great. These guys come back and volunteer their time to sit down and go on a one-on-one practically. You can tell it's good for the instructors too. They come and meet their old cronies from 20 years ago. They all come teach on the same day.
Oh, that's nice.
It is. It's great. It's great.
And then I know of course now that I'm your patient, you did a mold of my teeth. And of all the years I've been going to a dentist, I've never had a mold taken of my teeth. Why did you do something like this? Like, what's the value of this?
Well, first, it's a three-dimensional picture of a three-dimensional thing rather than x-rays, which as you know are flat. Even digital x-rays are flat. So there's a lot of dimensions that you can miss. It's also great for me as a dentist to look at different options to do things on a model before I go to your mouth and give it a try.
Right.
So many times I'll do a mock-up or a practice run of what I'm attempting to do on the patient's mouth, and I'll learn something like it doesn't work that way or it works over here but not over there.
Right.
Besides, don't like to experiment on my patients. Rather do it.
Get it on a mold.
Get it on a mold.
And so, and then you can see the teeth change over time, right?
Yes. It's actually an orthodontic standard to keep models like that so you can tell if teeth are moving. Again, which doesn't show on a two-dimensional film until they actually cross.
And is this something that, I know that you go to a group of you have other dentists you hang out with?
Yes. It's a study club, which is really great because it's just a non-competitive way. The great thing is to have models like that. You bring them in, you pass them around to your colleagues and say, what would you do? And sometimes the person goes, I'm glad that's not my patient. You just answer right back. But most of them will have a few suggestions. It really makes you think. Open a door that you wouldn't.
Yeah, I would think that'd be incredibly valuable. If I was like a mechanic or doing whatever job I was doing, I said, hey John, take a look at this. What do you think? Collaboration.
It is. It's great because there's avenues. Like if it's a tough enough case after this long that I'm not sure what I'm doing, and someone says, "Man, I had one of those 7 years ago. I haven't had one since, but this is what I did. Wish I hadn't done it that way.
Oh, gotcha.
But this is how it turned out." So it's a great forum for sharing stuff. It's like having 10 extra dentists on your team there.
And honestly, when I went to you again, I felt so comfortable knowing that you did this because now I know it's just not just you per se, but to have other eyes look at these things as well, you're getting other dentists contributing to your care, right?
It is, and I think for us dentists too, it's a learning experience. In other words, we have a shared experience of we're all out there practicing. This is all practicing dentists in this area, and someone comes up with something, even just learning about products or equipment.
Oh, okay. So you share about the new products that might be coming out?
What procedures, everything, even who to refer to, things that, there's a lot of dental products on the market now, and it's nice to know if they work or not before you start recommending. I hear everything from a rep that comes in my office.
So yeah, now that makes the next question is, you're up to date on the latest, what is the white filling called? The
composite fillings.
You do those replacements and so forth?
Yes, and those have improved incredibly since just the time I've been practicing in the last 30 years. The material has changed.
The material's changed.
The material has changed.
And they've gotten a lot stronger.
Because
wasn't that the problem with the composite stuff?
Yes, and I was pretty honest with people. I said, you've had that silver filling for 25 years, I'll put in a white one, but you're going to be seeing me in 5 to 7 years.
Okay.
We're going to be replacing those again.
Wow.
Some people were fine with it, but appreciating too, people don't want metals in their mouth for various health reasons. So the mercury
myth or the reality.
Yes.
I would rather not have the mercury. I don't have any mercury in my teeth. I've had it all taken out.
No, in this day and age, I very rarely place amalgams anymore.
Really?
No, most people, but some people just want white because they want white.
Oh.
It's not necessarily because they have any issues with metal.
Well, I know you do a lot of actors. I know you ever see actors in period pieces with the amalgam fillings?
Yes.
And they open their mouth. It's like, wait, this is 1400. How did you get the?
Yes. But then I also see a Western when they look like they've been on the trail for 2 weeks and they smile and they've got these perfect whites.
Yeah.
That wasn't the way back then either. They just pulled them.
Yeah.
Oh yeah.
They just pulled them, no anesthesia.
Well, there was no way to do anything, to a tooth. Then you pretty much, no anesthesia either.
You just yanked it out.
Just pulled them out.
So dentistry has come miles ahead in technology.
I wish I could say that, but I just spent Memorial Day weekend in Mexico donating my services down there.
That's right. You do that. You help.
Yes.
You help folks.
It's a clinic. It's run by the Rotary Club, but they don't have a dentist in this town. Take us down there, and pulling is still the norm for that. and sometimes they just try to pull them themselves.
Oh my gosh.
I mean, in our area of the world, sure, it's great, but there's still third world countries where extractions or self-pulling of teeth is the norm.
It's unbelievable.
Yeah, the United States has a different standard.
Well, it's because of the free market enterprise and people design things, and that's how.
Tell you the truth, England isn't all that great either. I hate to say it, even though they have free dentistry,
They have free dentistry.
well, but they just extract. I mean, if you
So
want,
they don't advance the technology as
no,
much.
but they have private dentists over there.
Yeah.
I mean, if you want to pay, there's dentists over there that are certainly up to tech. But as far as what's provided by the government, that's just one place where extraction is the same thing.
Key. Wow. So what other services do you offer besides fillings?
Fillings, we do bleaching, minor orthodontics.
What would
kinds
that
of
be, minor
compound fun.
orthodontics? What would that? Fixing a tooth?
Individual tooth movement, not
Oh,
changing
okay.
your bite. But say you've got a couple teeth that are crossed or one that you notice is moving out of the path.
Right.
We don't do full braces, but we do that. We do a lot of cosmetic veneers,
Okay.
which are fortunately being paid for by insurance if it's an alternative to a crown.
Really?
Although they are cosmetic looking, insurance wasn't covering them as a blanket procedure, as a cosmetic procedure. But now in lieu of a crown, if you've got decay on a tooth or
Right.
chips or edges that continually break off, it's a great way to go. A lot of people also need night guards and things for stress relief. which are
Because they're grinding your teeth.
very popular here in LA.
Right.
I'm kidding, but we had a speaker come in for our study club, and
Right.
someone raised their hand and asked, after you put all these veneers in somebody's mouth, is it a good idea to make them a guard if you think they grind? And the guy said, I've been in LA 4 hours and you all grind. And honestly, the room just broke up because I think it's a little bit true. With
Yeah.
living here now, we just don't see it that way.
Right. Wow. Okay, so you do that, and would that be considered cosmetic? All those veneers?
The veneers
are cosmetic.
They were cosmetic. Now they're structural. It's just an alternative before that person gets to a crown.
Right.
You're going to wait till it breaks down to nothing. If they've chipped it off pretty dramatically,
Right.
is there a way to do a conservative crown, which would be a veneer, just
Mm.
covering the broken part?
And of course, you do the extractions with the.
Yes.
How does that work? What do you call those? When you put the
Yeah.
titanium stem in there.
I work with the
Oh.
surgeon in my study club on that,
Wow.
on placing the implants. So yes, those are very popular. That's another thing that has come just miles and miles. Success rate is just through the roof on those.
How long do they usually last now?
A lifetime.
Wow, really?
Don't you know anyone's been in a motorcycle accident, has a pin in somewhere? How long does that pin stay in?
And what about the pain management? How do you manage, like when you're drilling and into the bone and so forth? Is there ways to?
Actually, it's been very surprising to me. I just had a patient. I thought I had verbally prepped them on what to expect,
Right.
but they had the implant done today, which was Monday.
Right.
And I called to see how it went, and they said, I feel fine. I took a whole week off work for this.
Oh, you mean because they didn't have any residual pain?
Yeah,
Nothing lingering.
nothing. And I had told them, you don't need to, you can take the day off, but they go, I'm fine. I don't even have anything
Wow.
planned. The reason for that is that bone is not very innervated. Bone does not have a lot of nerves in it.
Okay.
Personally, I would rather have an implant put in bone than I would to pull a muscle or a ligament or a tendon. Those things are very
All nerve
innervated.
endings,
You
right.
do hear somebody that's walking around on a broken bone
Yeah.
because there's just not that many nerves in it. When it really hurts is when it goes out into a soft tissue structure. Then you hear about it. But someone go, gee, I had a fracture in there. I didn't even know it. I was walking around and took an X-ray and said it's broken.
Wow.
So the implants.
So
and also
pain
bone-
management with teeth nowadays is
It's
handled.
different,
You
and
can
bone
handle
doesn't
it.
swell. There's no
Okay.
swelling on an implant. If
Okay.
anything, routinely I hear was much easier than I expected.
So you do whitening as well? Just
Oh,
like
yes.
and
Yes.
is
Yeah,
whitening is it better now than it was? I mean, it used to be what? You had to sit with a laser in your mouth for a half hour?
Yeah, it's better, but there's also a huge variety of products out there,
Oh.
and I think part of our job is to get down to which ones work, and
And you have a staff that does just that? Just that.
I do.
Okay.
Well, I mean, I have a staff, and some of them are specialized
They're
in
specialized
training,
in that.
in
Okay.
training for that. So yeah, we found some stuff we really like and
Yeah.
figured it's cost efficient and not too hard on the patient, and
Yeah.
people like it.
Remember you and I were talking once about a smile? And there's a photo right there. Let's see this photo.
This photo?
Yeah. Now this is, these are teeth that are receding,
Correct.
right? And
This is a photograph of a connective tissue graft, and I think it's relevant because people are getting older,
Yeah.
and we all get long in the tooth when they're older. So this is showing is before and after pictures. This is a graft that's taken from somewhere else in the mouth, the roof
Right.
of the mouth, and moved over and actually sutured in there and it's grown back over the tissue, because this tissue will not regrow on its own.
Well, and so you do all this too?
Mm-hmm.
So, oh, wow, okay, great.
So if you have areas like this,
Yeah.
then I said the tissue is taken from the roof of the mouth and moved over and covered over onto there.
How long does it take for something like that to heal?
This is after 3 months, and this is after 1 year.
Good, okay. Okay, so you can do this, it takes about 3 months to heal.
Correct.
Okay, great. Wow, I didn't know you do that. That's pretty elaborate kind of surgery, I would think.
Yeah, it's soft tissue surgery though.
Wow. And then you were saying that you've noticed people's smile actually change after you've done some.
Absolutely.
After, like, I guess they're not used to the fact that they don't have to cover their teeth. They've done it so long. They've never opened up their smile,
so long,
right?
and what's been interesting to me, if you talk to them, they say they don't. No, that's just the way I laugh. That's just the way I smile. That's just the way I do it.
Right.
But once they get their teeth completely corrected, they just lose all that self-consciousness and mannerisms, whether it's conscious or not.
Right.
But someone that's got a big gap on one side, they kind of learn they know what their good side is, and they compensate for it a little bit. So it's really great.
And you have photos of that, right? Don't you take photos of people before and after smiling? So you really see them, they just light up.
Yeah, they do. On the second one, it's almost like you don't want to tell them, you want to tone it down a little bit. I guess the other one was I had fixed this woman's teeth, and her husband told me I can't stand to walk with her through the mall anymore because every storefront window she turns and looks at her teeth. It's not.
Was she so happy with him?
Yes, because she can't believe it's her. The reflection in the window. She was so used to the old person that now when she walks by, she just has to check and see if it's really her.
Well, don't you think some people are concerned try getting work done like that because it's expensive?
Yes,
Yeah.
I'm sure that's part of the concern. But
and then how do you handle that?
I think the first thing you need to do is get them in, get a set of those models, and break it down sequentially or phase it, so that they can get the things that they need to afford. Or a lot of it, if we can get a jump start on preventative stuff, that it doesn't get, if it's going to cost X amount this year, in 2 more years it's going to cost 3X, then I think we've been pretty good about, there's things like putting spacers in so the teeth don't tip over, there's temporary fillings that last quite a long time. There's things you need to do. You need to sit down and really have a dialogue, a conversation with that person about what's important to them and what we can do to have them save their teeth.
Now, insurance will cover some of this, or?
Oh, yes, but sometimes I need to phase it with the insurance.
Oh, I see.
Sometimes I need to do what we can this year, get you in a holding pattern until the year changes.
Oh, is it because of the limits of the insurance?
Yes.
Oh, I see.
Every insurance has limits on that.
Oh, wow.
But
you can manage that with the patient. You can help them through that process.
You go online, you see what their benefits are, you see what they're paying for this and that, and
Right.
you go for the year till you max it, then you stop.
Mm.
And you let them get settled with what they have, and January 1st, we start in again. So
Mhm.
sometimes I have people treatment plan for the next 2-3, I already have people scheduled for 2014.
Wow.
Well, to do the next phase of their mouth.
Mm-hmm.
But
Wow.
I think people feel motivated when they get started and they know they've got a plan on paper and they have a direction. Really, so many people come in that haven't maybe ever been or 12 or 15 years, and I think they're expecting the worst.
Mm-hmm.
And if you really get down and get all the information gathered, and okay, this is the plan, boom, boom, boom. Gosh, I think 90% of them say, wow, okay, let's start.
They see where they're at, they go, okay, you've just made it clear for me how to get to why.
They
and
can't just
feel
go in the
comfortable.
mirror and look at a couple missing or black teeth and do it. That's just not feasible.
Right.
I can't even do it that way. I need all my information
Right.
to go forward and then present the options that they have to do it. And most people, given a plan of action, will go ahead and start. They just don't have a plan of action, I think is why they don't start.
And they don't start because of that. But and I think, what are some of the excuses you hear about why people never came in for years and years and years
Fear,
of
pain,
the pain?
pain.
But you said you had that pretty much handled.
It's
now.
pretty much handled.
So when you're drilling into the bone and you hear that sound of that drill,
I'm
saying
sorry,
that
but the last time Marathon Man was on, 4 people called me. I don't think good dentistry's gotten much in the media in terms. It's still a horror story, isn't it? Isn't that everybody's little nightmare of pulling teeth or things or screaming or whatever?
Yeah.
So no, it isn't like that really.
Yeah, well, that's amazing. Is there anything else about your office that you'd like people to know about that we haven't touched on?
I think we think we're pretty user friendly, people friendly.
That's right. And you pride yourself
Well,
on keeping your appointments on time. That's
absolutely.
important because I don't want to sit in an
No, you know
office
what?
for a half hour waiting. I find it to be kind of rude.
I do. And if someone is waiting more than 20 minutes in the waiting room, someone from my staff will go tell them why they're waiting, which a
Mhm.
lot of times it's an emergency or something like that.
Right.
Offer, if they would like to reschedule, they have that option, or they're more than happy, they will be seen if they choose to wait.
Mhm.
Usually it's something out of our control.
Right.
But I think the worst thing, if you leave them sitting there and them not knowing what to do, and if we go out and say, you know, it's gonna be this long, if you'd like to go to the car wash, go ahead and come back, you'll still have your spot. So just be respectful of people's time. That's for anywhere in the world, not just a dental office.
So great. So you're prompt. You let people know about their appointments. They're on time. You guys handle the insurance,
Yes.
promptly for people. You show them a plan how to get their teeth up to date.
I think the other thing we like is we're pretty much off referrals. I mean, we have people that, we have entire offices, entire.
Wait, how long have you been there now?
30 years.
You've been there 30 years.
30
and
years.
you've just been in most of the referrals.
Yes,
Wow. That says something.
yes, I don't have any print advertising or anything out on that, but that's the best referral.
Yeah.
You know, it's very strange. I've even had people come in on referral and they ask who referred you, and they wrote somebody in the store. And we said, what? They go,
Somebody random.
I was in the
Rock and
aisle.
roll Rouse.
It
They
was,
come in and say,
it
hey,
was, my
check
tooth
your
was
Weaver.
hurting, and I was in the pharmacy looking for something to put in it,
Right.
and the person I got in the conversation with this person, and they said that, so they took a referral from someone they didn't even know,
Wow.
which it's just the power, I think, of word of mouth. No, they didn't know
It's
this
a testament to your
person.
good work and your
They-
office's work too.
They
Because I know
thought
you
I have to choose somebody, so
Yeah, you get a friendly staff. I know when I come in there, everybody's, it's nice. It's a nice office.
we have fun.
Well, great. Thanks for being here. I'm
Thank
glad we
you.
had the chance to talk and let people know more about your business and what you're doing. You're 30 years, and that it's an amazing achievement.
Great run.
Right.
Are we done?
You guys are watching this. How's the camera?
I guess for that good.
Mm-hmm.